referring to quarantine measures in relation to context. There are different interpretations, because in some cases people talk about quarantine measures in relation to travellers arriving from another country who are not necessarily contacts of a case, and then there's quarantine for people who are documented contacts of cases. In the case of contacts of confirmed cases, WHO's recommendation is that all such contacts should be quarantined for a period of 14 days. That quarantine can occur in a facility, or it can occur in the person's home, as long as there's an appropriate way for that individual to isolate themselves from others who are not designated as contacts. We do believe, and Maria may speak to some of the evidence on this, in countries that have been successful in implementing that, have made a lot of progress, especially in shutting down, and you see it with shutting down of clusters in particular. It's not so obvious in the middle of community transmission, as it takes time for that impact to occur, but we've seen some pretty intense clusters of cases shut down fairly quickly when quarantine has been implemented successfully in contacts. The DG obviously spoke to the issue of public health law. Quarantining oneself when you are a contact is an act of courage, and it's an act of contribution to society. If you're a contact of a case, then you are much more likely than any other person around you to develop the disease and potentially transmit it to somebody else. It is much, much better if someone is ready, willing and able to quarantine themselves on behalf of their community. But there are situations in which that is not the case, and some governments have public health law in place that allows them to make that a mandatory procedure. In other words, it's mandated by law. If it is such, and I think WHO's guidance is also clear, and I think we do clearly state that where such mandatory quarantine rules are in place, the state implementing that mandate must also respect the human rights of the individual. They must be in a position to provide an appropriate level of support and care to that individual. That should not cost that individual in terms of extra out-of-pocket expenses for the purposes of staying in a hotel. We don't recommend that governments charge people for being quarantined. So there's a whole load of issues that are associated with that issue. So sometimes a mandatory nature of quarantine allows a government in law to provide more support to people being quarantined. But we do and are against coercive procedures. And in our experience, yes, it may be that people may say making these things to be implemented coercively, it gets the job done. Well, in our experience in WHO in dealing with communities, particularly marginalised and other communities, it can do exactly the opposite. It can shove the problem underground. And it can mean that people are unlikely to report their status in terms of either being a case or being a contact if they feel they will be unfairly treated. So it is exceptionally important that we build strong community engagement, that people, individuals and communities understand how the disease is spread, understand the role they can play in the transmission of the disease, and understand the role they can play in breaking those chains of transmission. In our experience, when people understand that fact, when they understand their own personal status, and when they're supported in the process, the vast majority of people will participate in the quarantine mechanism. And we would like to avoid coercive mechanisms to do that. Maria?
Thanks. Thank you for the question. Yes, I think indeed quarantine in the context of contact tracing is arguably, one of the most important elements to breaking chains of transmission. Isolation of cases, known cases in facilities outside of the home, in particular, if that can be done, and if inside the home it's among someone who is experiencing mild disease or no disease, or among an individual who does not have risk factors that would put them at a higher risk of developing severe disease or dying. But quarantining of contacts is incredibly important. We will be updating our guidance. In fact, we're doing it now. It's almost as if you knew that, Jamie. But we are updating it at the moment, and it won't actually change that much. What we're changing in it is looking at, currently we require testing at the end of the quarantine day period, and we will be removing that. But we're also going to add language in there to ensure that family units are taken care of. And so making sure that the language that's in there really focuses on children and isolation of and quarantining of children with family members and parents so that they're not separated. So that should be coming out hopefully in the next week or so, but it won't look that different to what the current version is online. And it does really remain an essential element to breaking chains of transmission.
Thank you, Dr. Van Kerkhove and Dr. Ryan. We now have a question from South Africa, from Sophie, from the South African Broadcasting Commission. Sophie, could you